and that requires treatment of over $1,000 a tooth, and there's no help given whatsoever to children that get, or their families that get that condition. The figures have gone up by about 9% since 86, 87. So now the Center of Disease Control says that 32% of all American children, that includes children in non-fluoridated and fluoridated areas, have this condition. The ADA, the big promoter of fluoridation in the United States, put out in a e-gram the message to their constituents, their dentists, this is the advice you should give to parents. If using a product that needs to be reconstituted, parents and caregivers should consider using water that has no or low levels of fluoride. Now, they gave that advice to the dentists. They did not get that advice to the public. They didn't make any efforts to do that. And they certainly didn't get this information to low-income families, or even offer a way that low-income families could get water with no or low levels of fluoride, because they can't afford it. I'm going on to the early reversible effects. It was known very early on. This is a report from 1961, that some people were sensitive to fluoride. 1% of the study group here that were given tablets of 1 milligram of fluoride a day developed some kind of symptoms, skin problems, gastrointestinal problems, and neurological effects like headaches and so on. And all of these effects were removed if the tablet was removed, and returned if the tablet was given again. You know, there was always the placebo tablet and so on. So there was some scientific basis for the fact that some people were sensitive to fluoride. This has never been followed up, despite subsequent studies. Bruce Spittle wrote a whole book on a book called Fluoride Fatigue. And it's interesting that those who do complain of fluoride sensitivity have symptoms which are run parallel, not completely, but run parallel to the symptoms of hypothyroidism, lowered thyroid function. More about that in a moment. The turning point from a scientific point of view was the National Research Council report that produced a 507-page report with over 1,100 references on March the 22nd, 2006. I'm happy to tell you I was the only scientist opposed to fluoridation that actually testified before this panel. They gave me 45 minutes. And I'm also even more happy to say that much of what I shared with them, they have since shared with the public and the scientific community. This was a landmark. This was the first panel in American history on this issue that was ever balanced, which was not handpicked just to have pro-fluoridation people on it. Here's the report. They concluded that the current safe drinking water standard for fluoride in the United States is 4 parts, which is now 4 parts per million, was not protective of health, and they singled out severe dental fluorosis as an adverse health effect because it increases the risk of dental decay, and they didn't, but other people said you should also include moderate for that category. The early symptoms of skeletal fluorosis, which are identical to arthritis, they say this is an adverse effect. In the study that went to determine the 4 parts per million level, the only health effect that they considered was crippling skeletal fluorosis. Fluorosis, where so much fluoride had accumulated in your bones that your whole backbone is fused. You can't raise your arms above your shoulders. In severe damage to the skeletal system. That's the only health effect. And for some extraordinary reason, when you've got the statutory requirements to consider the lowest observable adverse effect level, obviously between solid, good, healthy bones and being crippled, there's something in between, right? You don't need to be a rocket scientist to deduce that. So they should have had a lower level than that, and that's what they're advocating. They said lower levels of skeletal fluorosis, earlier stages, which have symptoms identical to arthritis, which impacts millions of people in fluoridated communities, should be considered. and the increase of bone fractures all should be considered. In a new health risk assessment, which they asked and they didn't rule out the possible cancer-causing ability of fluoride. At that time, Bassin's study on osteosarcoma had not been finalized, hadn't been published. So they're waiting for that. But they said the jury is still out on osteosarcoma. They recommended that the EPA Office of Drinking Water determine a new safe drinking water standard, the maximum contaminant level goal. The United States has two standards actually, MCLG and MCL. Maximum contaminant level, MCL, is the federally enforceable standard. The MCLG is a goal based upon the best science, the ideal goal, which you can seldom reach, but it's good to have a goal. It's the level which is considered safe. The MCL is a compromise with economic consideration. So they said, do a new MCLG. After over 4 years, the EPA has not done this. Why is the EPA not doing its job? I can do the calculations in about half an hour, maybe less, which shows that the MCLG should be less than 1 part per million if you take the health effects described by the NRC. If you do the standard, use the standard assumptions and safety margins, and you do it honestly, you do it with integrity, the MCLG would have to be less than 1 part per million. But you know the consequences of that. It would end fluoridation immediately if they were to do that. So the end result is they don't do it. And so once again, we're waiting for Godot up there. Fluoride in the brain. Problem with the brain is that the blood-brain barrier is not fully developed at birth. This is why we need special care with pregnant women and so on, because their babies and their infants and their fetuses don't have the protection that we would want. The baby should not be exposed to fluoride at up to 250 times the level of fluoride that occurs in mother's milk. That to me was the most convincing factor to end fluoridation. One wonders what an increase in the exposure to fluoride such as occurs in bottle-fed infants may mean for the development of the brain and the other organs. This is Arvid Carlsson in 1978 when they were preventing fluoridation from going into Sweden. And when he made that statement, there was practically nothing in the literature about fluoride and the brain. The NRC concluded it's apparent that fluorides have the ability to interfere with the functions of the brain. So Carlsson was right to be concerned. There have been many more studies on the brain that have been published since the NRC review. There have now been over 100 animal experiments which show that fluoride can damage the brain. They would say many of them at high doses. We don't have to worry about those. But in this one study, they gave the rats 1 part per million fluoride in their drinking water for 1 year, same level as we get. And both groups had kidney damage, brain damage, greater uptake of aluminium into the brain and beta amyloid deposits, which are characteristic of Alzheimer's disease. Absolutely no follow-up in any fluoridating country. That's now 12 years ago. Nobody's attempted to reproduce this in Australia, New Zealand, Ireland, etc., etc., etc. Human studies. And of course, when the MRC report in 2002 was reviewing this issue, they gave study of dental fluorosis more priority than the study of that. Incredible, isn't it? Human studies. There are now 23 published studies from China, Iran, India, and Mexico indicating that moderate to high fluoride exposure is associated with lowered IQ in children. See fluoridalert.org. This is the most important study. Zhang compared children in 2 villages, less than 0.7 and 2.5 to 4.5 parts per million in the water. I visited those villages, met Zhang several times. They did control for lead exposure and iodine intake. Scher got that absolutely wrong there. They said that none of the studies, IQ studies, had controlled for that. This is a European group that's looking at fluoride right now, supposedly scientists. They found a drop of 5 to 10 IQ points across the whole age range, and he estimated, Zhang, that the IQ would be lowered at 1.9 parts per million of fluoride in the water. No fluoridating country has attempted to repeat that study or even look at IQ. There is absolutely no adequate margin of safety. If fluoride is associated with lowering of IQ of children at 1.9 parts per million, in a small population study, I mean it's about 300 kids, you can't then just say, oh, that's a study at 1.9 parts per million. Thank God we're only going to fluoridate at 1 part per million. First of all, there's a difference between concentration and dose. A child that drinks 2 liters of water at 1 part per million is going to get more fluoride than a kid drinking 1 liter at 1.9. That's not rocket science. And also, if you're only looking at 300 kids and you are going to use the result to discuss what's going to happen to 100 million children, do you think you've covered the full range of sensitivity to fluoride in a study of 300 kids? No. We got millions of children. You normally have to use a safety margin of 10 to allow for intraspecies variation. But your SHA hired Bayesian Limited, a user-friendly, government user-friendly body, say no more. And they looked at these 18 studies, and the only reason they had those 18 studies is because I gave them to them. They didn't get them themselves. We had to get them. We had to get the Chinese, this is Fan, we had to get the Chinese studies and have them translated into English, and we presented them on a plate. If we hadn't done that, they would have denied that any existed. But they had this, and they pulled off a beautiful bit of linguistic. Many of you do not know what I'm about to tell you. If you read it carefully, when the Bayesian reported on this review of these studies, they said the studies were of mixed quality, blah, 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 and they have no direct, notice the word, no direct relevance to Southampton. And what they're meaning by this, when they use that word direct, they are saying this study was done, or these studies were done above 1 part per million, and Southampton's going to fluoridate at 1 part per million. So there's not direct evidence. It's not as if you've gone to a community that's had 1 part per million and you're now considering Southampton 1 part per million, which is lunacy. I mean, that is making no distinction between concentration and dose. And, you know, from a toxicological point of view, it's nonsense. A toxicologist, as a matter of routine, when the new chemicals come out, is trying to extrapolate from high-dose animal experiments to the possibility of damage in low-dose human situations. And that's one hell of a task, to extrapolate from high animal doses to low human doses. And industry has made a big song and dance about that. But in this case, we have the luxury of human studies at levels uncomfortably close to the levels at which we want to fluoridate. And we're told there's no direct evidence. Give me a break. I hope they're spending the money they earned for that little bit of prostitution. Well, I hope they're spending it well. Maybe they're giving it to charities. So there's no adequate margin. Basically, there's no adequate margin of safety to protect all children in society. The thyroid. Several lines of information indicate an effect of fluoride exposure on thyroid function. That's the NRC again. You have doctors were using low doses of fluoride to lower thyroid function in patients with hyperthyroidism, the 30s, 40s, and 50s. These levels are reached by some people in fluoridated communities. In Ukraine, Brzezinski and others found that water containing 2.3 parts per million of natural fluoride in the water was a risk factor for more rapid development of thyroid pathology. Again, no safety margin here. Subclinical hypothyroidism is associated with increased cholesterol, increased depression, cognitive dysfunction, decreased IQ in their offspring. So when we talk about something that may contribute to subclinical, even subclinical, let alone clinical hypothyroidism, we should be very, very exercised. But again, the MRC put a higher priority in looking at dental fluorosis than looking at thyroid function. If fluoride lowers our thyroid function, it could explain the delayed eruption of primary teeth, the malocclusion of teeth, lowered IQ in children, increase in hypothyroidism among US population which is growing exponentially in the United States.